Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we bring you key experts in the fields of nutrition, prevention, integrative, and lifestyle medicine. Today's show topic is going to be the role of cholesterol-lowering drugs, statin drugs, in the prevention and treatment of heart disease. And the question is, are they needed? And my guest today is going to be functional medicine, integrative medicine cardiologist, Dr. Daniel Van Hammersveld, who is a colleague at our clinic, who has some, I would say, pretty strong opinions about the use of statin drugs in cardiovascular disease. So, welcome, Dr. Van. Thanks for being on the show today.
Yeah, thanks for having me. It's a pleasure to be here. It's a very timely topic, I will say.
So, how long? Well, let's put it this way. When did you start using statins in cardiology? Because you've been doing cardiology, was it 34 years, 30 some?
44 years.
44 years.
44
Wow.
years. Yeah.
So,
So I started using statins pretty much right out of the gate because they were developed in the 1980s, and I went into practice in 81. So within 10 years, they were available. And so I pretty much started using them right away just because the literature at the time seemed to suggest that cholesterol lowering was really important to reducing the incidence of heart attack and coronary heart disease. So everybody was on the bandwagon. And the problem was that it took a while, especially for me, it took a few years before I started to see people having side effects, not necessarily serious side effects, but once in a while, you would have a patient get rhabdomyolysis, which is a severe breakdown of skeletal muscle causing kidney failure. And that was hard to ignore. But many people would have lesser side effects like, mild muscle pain or muscle weakness. And so I kind of went along with the flow for a long time because we all relied on the literature for guidance, all the major journals, major clinical studies, and they all seem to show that cholesterol lowering with statins reduced coronary heart disease. The problem was that these studies turned out to be mostly biased and funded by drug companies, and they used various statistical tricks, like, for example, calling the reduction in heart disease risk by the relative benefit. So, for example, they would say if you use a torvastatin 40 milligrams a day, after 3 years, you'll have a 30% reduction in heart attacks, which sounds pretty good. But then you realize that actually the absolute reduction in risk is maybe 1%. So you'd have to treat 99 people with this drug for 3 years to get one person that would benefit. So everything was misleading. And so it took me a long time to start figuring this out. But about 10 years or so ago, I started to get outside the box a little bit and go to more unbiased sources. And I realized that statins are essentially a metabolic poison, and they have many adverse effects, and they do lower cholesterol, but it turns out that cholesterol does not cause heart disease, lo and
well,
behold. So
let me ask you a question. Then was it the concern about side effects that got you started, like you'd see them in patients and then you started thinking, or what was it that started to make you think? Did you doubt big pharma for some other reason, or what made
not
that
for yeah,
click?
not for a long time did I doubt big pharma, but the side effect issues were coming up, and a lot of my colleagues were noticing some of the same things. But the pressure was very high that statins were just so important. And one of my former partners said they should be in the water, which is unbelievable. So, but you have to go back in time. 150 years ago, pathologists were seeing in arteries of people who had died in autopsies that if there was plaque, there was cholesterol and fat in the plaque. And so that led to the idea that maybe cholesterol was part of the whole scene. And then, heart disease was very uncommon until after World War II. And so in the 50s, we had increasing amounts of heart attacks. But then the big one was Dwight Eisenhower had a heart attack. And he, of course, was a 3 or 4 pack a day smoker, but nobody talked about that. They just talked about this heart attack. And now, what are we going to do about this? This is a major, health problem we need to think about in the United States. So people started working on research to figure out what was causing heart disease.
Well, wait, can I ask you a question? So, was it that there was less cardiac events or people, because if people weren't living as long, they wouldn't have as much time to have more cardiac events. So, in other words, if people were living earlier in the century to 65
Mhm.
and now we're living to 80, then there would be more time for cardiac events. So, that I've heard that said before that there was less heart attacks. Um, I
Yeah,
just
that
curious about that.
there's some truth to that too, but lifestyles were changing as well. One of the big things was seed oils. Crisco came out about 100 years ago, and then cottonseed oil, canola oil, all these oils came out, which turned out to be they were in liquid form. They were made under high heat. They were terrible in terms of oxidizing as soon as they were heated up. So people were using this stuff uh, in their diet. So that was one of the major sources of fat, which is highly atherogenic. So that was going on. And then in the people were eating a lot more, starting to eat more processed foods, more carbs, and of course, a lot of people were smoking at that time. Smoking was a big thing. So there were a lot of different factors. But after Eisenhower, people started thinking, well, what's causing this heart disease? So there was a guy named Ansel Keys in the 50s. He got the idea that saturated fat is causing heart disease. So he did a study using 22 different countries around the world, first world countries. And so he looked at all these countries in terms of what's the amount of saturated fat people are eating versus what are their cholesterol levels. So in just 6 out of these countries, there was some relationship. So he cherry picked only those 6. He published a study that showed cholesterol and saturated fat causes heart disease. And so right away, everybody got on the bandwagon. He was on the cover of Time magazine, and the American Heart Association was all over this. And so, by virtue of that flawed data, we started saying saturated fat is bad, and therefore cholesterol is bad because it's related somehow. So then that led to these dietary guidelines that were adopted by everybody, wherein you want to have a low fat, high carb diet. So bring on the pasta, bring on the bread, and stay away from the fat. No egg yolks. So that was in the 60s. And so since then, we've had our epidemic of obesity, diabetes, more heart disease, thanks to all this misinformation. And in fact, many other studies have refuted all this and have shown that when populations have a higher diet with saturated fats, their heart disease goes down. Saturated fats do not affect cholesterol levels. They do not affect LDL. They reduce heart disease. And so, but even nowadays, that is a very minor opinion that most doctors are not even aware of. And so the statins came along. And also, you need to think about the fact that the sugar industry back in the 60s was very big here because there was starting to be concern that sugar might be a problem for health, excess sugar. So the sugar industry wanted to protect that idea. So they started saying, well, sugar is pretty benign, except if you eat too much, maybe you'll get cavities. But they funded all kinds of studies to promote the idea that sugar was benign. And they wanted to focus the attention on cholesterol. So
So let me ask you this then. I want to go back to a statin drug because
yeah,
people may not know how they work. How does a statin drug work in inhibiting cholesterol production, or
right.
how does it work?
So in reference to this, so the cholesterol worked by blocking a specific enzyme in the liver. which makes cholesterol. And so you take the drug, your cholesterol drops quite a bit, 30%, 40%. And so that's pretty straightforward. But the problem is the same enzyme ends up making all kinds of other things that are very important to our health. One of them being CoQ10. Coenzyme CoQ10 is an enzyme that is critical for mitochondria in all of our cells to make energy, especially in our heart cells where we have more than anywhere else per cell. And there's also a group of chemicals called dolichols, which are responsible for brain health. And without them, you get things like Parkinson's and other neurodegenerative diseases. So that's gone with the statin drugs. And so you're treating something that doesn't cause heart disease, and you're getting a number of adverse effects that are terrible in the long run. So not a good trade-off.
Then how did you make a transition? I mean, did you just tell your patients, hey, you know, cholesterol doesn't mean anything? I mean, so you do lipid profiles
Yeah,
for a reason. Okay.
yeah,
So if it's not cholesterol, then why else are you doing it?
right. So that's the point. Is so if it's not cholesterol, what is it? So heart disease or coronary artery disease is really related to inflammation. So higher levels of inflammation will promote uh, atherosclerosis in the sense that it will promote damage to the endothelium, the inner lining of the arteries, which the body will try to heal with various chemicals, including cholesterol, which is an anti-inflammatory compound. And once the plaque forms, if the same inflammatory factors are around, then the plaques will often progress and eventually potentially lead to a heart attack. So what is the cause? Well, it turns out when you look at the lipid profiles, we've got, cholesterol itself. A lot of people don't understand that cholesterol does not exist floating around in the bloodstream. There's no such thing as cholesterol floating around in the bloodstream. It is insoluble in water, and it needs to be in lipid particles like the LDL particle, which is so-called bad particle, bad cholesterol. But and then we have the HDL, the good cholesterol. So all cholesterol is floating around in these particles. But it turns out that that we've had this diet heart hypothesis forever, even to the present time, which I've touched upon already, which means high saturated fat promotes high cholesterol, which promotes heart disease. But what it really turns out is that sugar and the vegetable oils we talked about are really the culprits, because any excess sugar in your bloodstream promotes inflammation. Sugar molecules are highly reactive. So when you eat bread, and that bread gets digested down to glucose, which gets absorbed in your bloodstream, it binds permanently to whatever it comes in contact with, like endothelial cells, like red cells, which is where we get our hemoglobin A1C levels. Or in the brain, it starts denaturing proteins. So sugar is bad news. And one of the lipid particles that I didn't mention yet is the triglycerides. So triglycerides are fats that are different. They are made up of fatty acids with a 3-carbon chain that is a storage form of sugar often. And so excess sugar that is not used for energy and gets to the liver will be put into the form of triglycerides, which the body can use for energy. But excess triglycerides means generally smaller, denser LDL particles, which are otherwise perfectly innocent. But once they get damaged, oxidized, they can cause trouble. So the triglycerides, which are directly related to excess carbs, are a much more important problem. And what also happens is when your triglycerides are high, your HDL goes down, and your HDL cholesterol is responsible for helping to mobilize cholesterol from the periphery, bring it back to the liver to be processed into what are called VLDLs, which then get released to travel around through the bloodstream, send their triglycerides and cholesterol wherever they're needed. And when they get smaller, they turn into LDLs, which eventually go back to the liver and get broken down, and the whole process repeats. So it's the triglycerides that I think represent an excess of carbs and excess of vegetable oils and things that are really at fault. And I started realizing this, and so I became familiar with the triglyceride to HDL ratio, which is a much more a much better measure, I think, of cardiovascular risk or vascular risk. And so, if that ratio is really good, like below 2, then your LDL particles are generally large and fluffy, and they're bouncing around like beach balls instead of golf balls, and you're not going to get the atherosclerotic process building up. So that helped me to kind of get away from statins, because there just isn't any point in lowering the cholesterol, in my opinion. And the price you pay is immense. So, for example, with statin drugs, it's virtually, in my opinion, malpractice not to give CoQ10 with them, because they destroy CoQ10. But beyond that, there was a study recently where 46% of women got diabetes within 5 years of taking statins because they cause insulin resistance. And the LDL cholesterol that we talked about in the bloodstream does not cross the blood-brain barrier. And so every organ and every cell can make its own cholesterol, and the brain makes its own cholesterol, no problem. But statin drugs cross the blood-brain barrier. So here you've got statin drugs going into the brain, blocking cholesterol production, which is critical for all the millions of new brain cells you need every day, for all the neuron sheaths that you have around each neuron, and for interconnections. And so once that starts happening, then you've got all sorts of bad things. Dementia, Alzheimer's are potentials, and some of that is not reversible. And then you've got an increase in cancer risk. You've got muscle weakness that we talked about, which can be diffuse and severe. You've got, generalized weakness can happen. Heart failure can happen because, like I said, the heart depends on lots of CoQ10 to generate energy to keep heart function going. So heart failure is a direct result, or can be a direct result, of using statin drugs. So there's a lot of negatives. And now, one thing I will say is that statins are somewhat anti-inflammatory, and they do help increase nitric oxide in the endothelial cells, which is what we do want. So it has some positive things, but the overall effects, I think, are very detrimental. And in fact, if you look at cholesterol levels in people, especially in older people, if you lower cholesterol, you increase mortality significantly. You increase the risk of cancer. And on the converse, when your cholesterol is high, the higher it is, especially when you're older, then you tend to live longer and have better brain function. And so the traditional thinking about cholesterol is by and large false, and it's been promulgated largely by big pharma because huge profits. The cholesterol drugs are some of the biggest money makers in history.
Let me ask you before you get going any farther. So, would there ever be a time where you use a statin drug to lower cholesterol? Or
Right, that's a good question. That's a good question. So, clinical studies have shown that if you're a man and you've had a heart attack or a heart event, then there is some benefit to using a statin after that. It can reduce the risk of future cardiovascular events somewhat.
Is that because it's anti-inflammatory? Do you think? Because it's anti-inflammatory?
Probably. It's not from cholesterol lowering, that's for sure.
Is there if you were going to use a statin, is there one that's less harmful on energy production or whatever you want to call it in the heart? Or is it they all work the same way?
They all work similarly. Now, if I was going to use one, I generally used what's called rosuvastatin, or the brand name was Crestor. because it's water soluble, so it doesn't hang around in the body as long, and it's also a little more potent, so you can use a real small dose. I try to use the smallest dose possible. So
So
that'd be
describe
one.
to me a patient, just describe to me a patient or the last time you wrote a prescription for a statin drug. I mean, I'm curious. What kind of patient was that? Can
Yeah,
you remember?
it was not specifically, but it's probably last year sometime before I retired. It would likely have been somebody, a patient of mine who, let's say, had an acute MI and got admitted to the hospital and ended up having a stent put in, and they were sent home on cholesterol drug for sure. And I would say to them, okay, yes, there is evidence that if you keep taking a statin, you will have a less likelihood of a future cardiac event. But we're going to adjust it a little bit. I'm going to give you a different statin and a smaller dose. And so I have no problem doing that as long as I monitor them pretty carefully. They're taking lots of CoQ10 and they have an understanding of what the potential side effects are. And we work together on that. So,
So I always see after like bypass surgeries, I mean, I
yeah,
see a really aggressive statin use. I mean, people
yes,
get a bypass and they'll drive the cholesterol. I mean, the LDL, they'll drive it down below 40. I mean, it's like
yeah,
lower the better type of thing.
yeah,
And
which is completely wrong. It's dangerous. LDL is not bad. It's important for function of virtually every organ. I mean, think of cholesterol. It's present in every cell membrane in our bodies. Multi billions of cells. It's important to make testosterone, estrogen, cortisol, vitamin D. It's like I said earlier, it's every brain cell needs cholesterol, interconnections in the brain, neurons. So cholesterol is so critical that by lowering that much, all you're doing is making the person less healthy, and it just makes no sense to me.
so let's have a conversation about you lump carbohydrates all together, which so I've studied Dean Ornish for years, heard him speak many times,
Yes.
and he has, they've done before and after angiograms, and that was 26 years ago,
Yes.
and his program isn't just a low fat plant-based diet. It also has group therapy, it has stress reduction, it has exercise.
Right.
But and then there's Dr. Caldwell Esselstyn, who I've interviewed before.
Hmm.
Actually, Cleveland Clinic surgeon, but his is a very low fat diet. And I see him giving
Yeah.
lectures at 86 years of age or 85 years of age.
Yeah.
And I've seen people who have reversed their disease. So there has to be, but they don't use drugs. Okay, they're not using a statin drug,
Right. Right.
and they're not eating any processed carbohydrate. So they're eating high glycemic excuse me, low glycemic carbohydrates such as beans,
Yeah.
lentils, peas. I mean, so there's some kind of, I mean, I think we have a broad spectrum of diet that we could consume and still not get heart disease. If number one, it was whole foods, you know what I mean? Because then you wouldn't have your processed sugars. I get where the sugar
Yeah.
comes from.
Hmm.
But sometimes, I see the swing go the other way. People just it's like eat all the meat you want. And
Yeah.
I
Yeah.
don't know. I don't see any of the centenarians eating high amounts of animal fat. They eat small amounts. They're not vegan, but they're not. You go to Okinawa, you go to Sardinia, and all those places, and they're not eating fish every single day either.
The blue
Um,
zones. Blue zones.
yeah,
Yes.
I studied the blue zones, and so
Yeah.
while they might eat some animal fat, they're not eating. They're eating lots of unprocessed carbohydrate. Right out of
Hmm.
the ground, whether it be beans and lentils, and then
Yeah.
obviously vegetables and that kind of stuff.
Yes.
And they're not using any processed oils.
Yeah.
So I think we have a pretty flexible range of food that we could eat if we keep the sugars out or processed food. We could probably sometimes eat animal food, sometimes not, and still live a long life.
Yes. I
If that
agree.
makes any sense.
No, I agree. I mean, I think some animal food I have no problem with as long as it's clean food, grass-fed beef, organic things. And in carbs, I mean, all carbs get broken down to sugar at one point. But if it's lentils and beans versus white bread, it's a huge difference because, like you say, it's got the low glycemic index. You've got lots of
Right.
fiber in the unprocessed foods, which really helps, slow the absorption and provides so many other nutrients and benefits. So I think carbs are not evil by any means, but it's like you say, it's mostly the ultra processed foods. The bread or the wheat that we have nowadays is genetically modified, so it's not like it was 100 years ago. And so especially in America, our diet is so poor with
Right.
the processed foods, the oils. So yeah, I don't think we should uh, demonize carbs per se, but it's
Well,
the
let me
quality.
let me ask you let me ask you one more question here. So some people are just going to stay on statin drugs. So we got CoQ10. I measure levels all the time. I try and
Yeah,
get it up. I mean, actually, Medicare pays for CoQ10 level. If the
yeah.
world ever knew you could protect people, and I tell them,
I'm doing that too
you know,
now that you showed me.
and
Yeah,
they people fight with you and say, well, my CoQ10 is better. I said, tell you what, take it wherever you get it, and I'll measure it. And if your level goes up to 2.5, in fact, Quest Lab used to have a range. It would
yeah.
say greater than 2.5
Uh-huh.
for cardiovascular risk, and then they took it away. But are there any other nutrients that you would give along with if somebody's on a statin
Yeah.
to kind of, I don't know, protect them or whatever? How would you do that?
Well, I will want them to take good doses of vitamin D because, again, you need vitamin D to make cholesterol and to absorb sunlight properly and make more vitamin D. I would have people take good doses of magnesium because magnesium really helps improve energy production everywhere, especially the heart. I'd have
Mhm.
them take probably NAC, N-acetylcysteine, because it's going to help make glutathione to help protect the liver. And so those would be some of the main things, in addition to a a really healthy Mediterranean style diet with lots of fruits, vegetables, nuts, and healthy proteins. So,
Okay. Because people are going to be on statins, whether you like
yeah,
it or not. And
yeah,
you want to protect them as best you can and try and make some
yeah,
sense out of it all.
yeah.
Um, I, I'm trying to think if there's any tests that would show that, well, aside from liver enzymes going up, that you would
Well,
have a negative effect
the
from a
CK will go
statin.
up, with muscle damage, but that's not that sensitive. So, um, I would have, I would not be using that often because if they have enough muscle uh, damage to be clinically significant, then the CK will be high anyway. So you're already going to stop the statin or change it.
Yeah.
Yeah,
It's not really a screening test either that we normally do.
right.
Okay. How does your favorite supplement Arterisol do for statin takers?
Yeah. Well, I love Arterisol, and hopefully you do too. But it's a beautiful supplement that promotes endothelial health, and so that in somebody especially who has coronary artery disease or vascular disease or is at risk, that's what they should be on because that'll help protect them from plaque uh, much more than statins, which actually statins will increase plaque. They increase the amount of calcium in a plaque. And you mentioned earlier about the calcium score. You were going to ask about that, but the coronary calcium score is an easy way to take a photograph of the heart with a CT scan to measure how much plaque is present. But statins increase that score, and
I
so
didn't
this,
know that.
and the score itself can be. I tend to use it sometimes when people have a moderate amount of cardiovascular risk. So in that case, if somebody has maybe a 50% risk and they've got some risk factors but not others, that will kind of tell you where they are. If they have a score of 0, then you can say, yeah, you're not building up plaque. If the score is high, then you can say, well, we need to start getting to work on measures to eliminate that plaque. So that's where the CT coronary calcium score can be helpful, I think.
Got it. Any other closing comments you'd like to make on the cholesterol statin debate?
Well, I just, statins, like you said, are going to be with us. The drug companies are very powerful. And so I just think more and more more and more discerning people are figuring it out, even without me telling them. And I think it's going to be interesting to see what happens with AI, because AI is providing a lot of medical information now. Not all of it can be relied on to be 100% true, but I think if people start investigating their situation, especially with statins, using AI and other things like that, they'll have to come away with a better idea of, hey, maybe this is pretty risky and maybe I shouldn't be doing this long term. So,
Maybe I can ask you this one last question. It's a clinical question for me. So let's say you're working with somebody and they have a high triglyceride HDL ratio, or they have a really high small LDL, and they just don't seem to be going to change anything. Um, then could you use rosuvastatin and maybe, what is it, ezetimibe? I've tried the cholesterol blocker at a low dose, and then jack them up with CoQ10 and a few other things. Would that be reasonable? If they're just not going to change and they got a really high small LDL or triglyceride
yeah.
HDL ratio?
Well, again, the way to get triglycerides down is with diet
I
and
get it.
style. But if, as you say, if they're not going to make a change, then I might want them to try to take a form of niacin they could tolerate, and then a low dose of rosuvastatin might be reasonable, because if the LDL particle number is very high, or if the small LDL particle number is high. But I wouldn't use an ezetimibe. That's never been shown to have any benefit for anybody. So I would never use that. And I'm thinking of one more thing too, is that statins have no benefit in women, especially in any case, any circumstance, including women who've had a heart attack. And
Well,
so just something to keep in mind.
all right. Well, you kept it in my mind, and I'm
Okay.
sure you will. And I'll just have
Okay.
to knock next door to ask my question. So
Okay. You bet.
I want to thank you very much for taking the time out of your busy day to talk to me about cholesterol and stuff. And hopefully, people have learned something. And I want to thank you, the audience, for listening to this edition of the Staying Healthy Today show. Until next time, stay and be well.
Thank you.
All right.